Now we're starting. Hey, everyone. Thank you so much for being here. I am thrilled to be at Duke. Can we give Duke a round of applause, please, before we get started? Woo! I want to go ahead and welcome all of you who are here in person. Thank you so much. And all of those watching online for the Summit on Empowering Eaters in Support of Health and Wellbeing for Future Generations. And I just really love this title for so many reasons that we'll learn about today. My name is Danny Nierenberg, and I am president and co-founder of Food Tank with Bernard Pollock. And for those of you who don't know, Food Tank is a research and advocacy organization that works to highlight stories of hope and success in our food and agriculture systems. And we do this with the aim to motivate, inspire, and ultimately activate positive transformation in how we produce and consume food. Again, it's a huge honor to be here in North Carolina and at Duke University. We are coming together to support the goals outlined in the Biden-Harris administration's national strategy on hunger, nutrition, and health. This is a national initiative to end hunger, reduce diet-related diseases and health disparities, and improve public health. I want to thank Kellyanne Blazek and Will McEntee, who are with us from the White House Office of Public Engagement, as well as Catherine Okar, who is on parental leave. They have all done incredible work to advance the administration's really, really important goals. And their leadership has been so personally inspiring to me because they are true public servants. Let's give them a round of applause, please. I am also inspired that the Biden-Harris administration has called on all of us as Americans, everyone in this room, health systems, insurance companies, nonprofit groups, philanthropic organizations, local governments, and other stakeholders to contribute to a White House challenge to end hunger and build healthy communities. And I love that they are using the term communities. No one in this room lives in a community that is not touched by hunger and chronic illness in some way. You'll hear from one of my favorite speakers today who works with food banks, and she uses this term that I really like when talking about the clientele of food banks. She calls them neighbors. All the folks who are experiencing food insecurity and diet-related diseases and other issues are our neighbors, our friends, the nurses and police officers and teachers who live in our communities. They are truly our neighbors. We all need to be part of the solution. The White House's new challenge brings in $1.7 billion in new commitments, building on the $8 billion in commitments announced during their historic 2022 Conference on Hunger, Nutrition, and Health. At the conference, President Biden announced the administration's goals to end hunger and reduce diet-related diseases by 2030 while reducing health disparities. I also want to thank our incredible host and partner, the Duke Sanford World Food Policy Center, especially Norbert Wilson, Deborah Hill, Kathy Kay, and Jack Daly. Round of applause for them, please. Today's summit truly would not be possible without them. I also want to thank Food Tank's team, our event coordinator, Kenzie Wade, and content director, Elena Seeley, for all of their work to build an exciting agenda featuring policymakers, chefs, researchers, advocates, business leaders, farm workers, academics, and other stakeholders. And you'll have a chance to hear from our incredible speakers very soon, but I need to give you a rundown of this afternoon. To make sure we end on time, and I promise you we will, we're going to keep conversations today very fast-paced and dynamic. And if we have to cut panels short, I hope you will forgive me later and understand that we really just want to have a really vibrant discussion all day long. And you will have the chance to continue today's conversations by connecting with the speakers and attendees during our breakout sessions and our reception, which you have to stay for. There will be plenty of delicious food. A big thanks to our friends at Bonterra and Ponysaurus Brewing for bringing a lot of great beverages to this event. Please make sure to step out for water and bio breaks during today. The coffee that you'll all be drinking is courtesy of Counterculture. we don't build breaks in because we want the experience for the live stream viewers to be as exciting for all of us as possible, as those of you in the room. So we have more than 2,500 people registered for the live stream, so say hello to them real quick with a round of applause. And I hope that you'll share today's conversations using the hashtag Food Tank and the handle @FoodTank on all social media platforms. We'll be trying to respond to as many of those comments, suggestions, critiques, and other comments during the day. I'm now really thrilled to introduce someone who I admire very much after having a wonderful call with him. He's very compassionate and a very kind person, and that's Dr. Greg Albanese, the CEO of the Duke University Health System, to welcome everyone. Over to you, Craig.
Thank you, Danny. Good afternoon, everyone. Welcome to the Empowering Eaters Summit. As Danny mentioned, I'm Craig Albanese, the CEO of Duke University Health System, and it's really a pleasure to be here with you this afternoon. And Duke's delighted to co-host the summit with our friends at Food Tank, which, as you know, is a nonprofit research and advocacy organization that highlights stories of hope and success in our food systems. We have a wonderful slate of speakers and facilitators who bring their expertise in policy, agriculture, public health, advocacy, and other key sectors to this exciting forum today. So you may be wondering, why is a health system CEO talking about food? Well, there are three reasons. First, food, or lack thereof, significantly impacts everyone's health and well-being. Second, partnerships and summits like this one hold absolutely immense power. And third, and this is personal, it's just heartbreaking to me that there are adults and children in the U.S. that go to bed hungry every night. As we all know, food is a key driver of maintaining health, recovering from illness, and helping manage chronic disease. Food as medicine is a scientifically proven remedy. But many people don't have access to affordable, healthy, or culturally relevant food. These issues are prevalent nationwide and even in our own backyard here in Durham. Fortunately, healthcare has undergone, if you will, an awakening with respect to social drivers of health. And these are defined as the non-medical factors that play enormous roles in the quality of life and health outcomes. They include socioeconomic factors like income, education, the physical environment such as housing, relationships, and food security. This is part of our mission at Duke Health. We're so much more than what I would term a transactional healthcare organization that simply just cares for you when you're ill, acknowledging when you're ill without acknowledging the whole person and how that person's health is affected by his or her environment. Rather, we at Duke Health care for our neighbors. Through the full continuum of life, we strive to improve community health, and we discover through innovation and research new ways to heal and to prevent disease. Addressing social drivers of health is absolutely critical to doing this well. Duke also has a role to play as the largest employer in Durham. I want Duke to be the employer that provides a pathway to economic mobility and stability, which in turn will positively impact the aforementioned social drivers, leading to a healthier community. To do this well, we need partnerships. No single organization, expert agency, or industry is able to tackle large systemic issues. Now, I don't have the answer to these big questions, but I do look forward to the dialogue that will be taking place here today. Healthy debate and discord will lead to innovative and collaborative thinking that will hasten impactful solutions. That's the power of summits like this one. It brings together a tremendous amount of intellectual capital. The speakers, the in-person and virtual attendees, and organizations like Food Tank. We need all of you, all of those joining us virtually, and your networks to help catalyze the type of change our community and our nation need to overcome food insecurity. and the chronic diseases our patients are experiencing. So thank you for coming together today. Thank you for advancing this conversation and action around these challenges and opportunities. I want to thank our organizers, speakers, and guests, the White House and our policy leaders for their leadership and focused attention on food security, health, and well-being. Our food tank partners, Danny Nierenberg, Bernard Pollack, and their team for their unwavering dedication to creating productive conversations and movement towards solutions. From the Duke World Food Policy Center, Norbert Wilson, Deborah Hill, Jack Daly, and Kathy Kay, thank you for designing today's program. It's a pleasure to see such a diverse group of panelists from various sectors. And our academic colleagues from Duke and across North Carolina, community-based organizations, policy advocates, and experts from across the state and the nation, and key staff from Capitol Hill joining us together today to lend their perspectives so we can learn and grow together. And of course, a big thanks to all those who helped make today possible. So now I'll hand it over to my esteemed colleague and friend, the Mayor of Durham, Leonardo Williams. Thank you.
Good afternoon, everyone. It's a pleasure to be here and bring greetings on behalf of and today I'm going to speak on behalf of the city of Durham, and I'm going to, because geographically we're one and the same, I'm going to bring greetings as well from the county of Durham. So I bring greetings to you from the over 326,000 residents of Durham City and Durham County. And this is the city of culture. This is the city of fun, coolness. I love to say Durham is dope. We are, dirty Durham. There are lots of reputations outside of Durham. We say keep them. We're fine. So trust me, you're in a great place today. I am originally from rural North Carolina, far down east, and I won't speak long, but I did want to say that I grew up in the church, and I would hear the testimonies, where someone stands up and say, I just want to thank the Lord for allowing me to see another day. And I, too, thank the Lord for that. But however, oftentimes people would avoid going to the doctor and they would continue their same practices. And I attended just as many funerals as I did family reunions. And it was always because of the same thing. We are what we eat. And in one of the most agricultural parts of the state, we had some of the most unhealthy eating practices. And that is something that is very concerning to me personally. I'm now in Durham, mayor of one of the largest cities in the state. And we have a lot that we can brag about. And I want to share some of those things. And I'm going to speak these things because I want to make sure that they are an example for what we can share across the state. And across our country, and hopefully across our world, our globe. So Durham County and City was one of the first to incorporate a county food security officer whose mission is to provide food resources for those experiencing food insecurity. There have been several high-profile events, actually, Secretary Janet Yellen has talked about. In Hunger Durham is a coalition of multiple stakeholders across our community, and I've personally had experience with them where we fed about 32,000 elderly and homeless and about 50,000 meals of those who were displaced during the pandemic with my restaurant. Also, the Durham Public Health Department is an award-winning, innovative nutrition. They have what's called a DINE team, Durham Innovative Nutrition Education Team. This is a phenomenal program. No one else in the country is doing it like we're doing it here. And they basically work with state and federal partners to administer the SNAP Ed programs through partnerships with our school system of over 32,000 students, over 3,000, 4,000 staff members. and also the local farmers market. Also, as a not only mayor, but as a restaurateur, my wife and I really encourage restaurants to source locally with our local farmers market, our local farmers, the Black Farmers Network, just farmers within the region. And that's something that's very successful. And also the Double Bucks program allow WIC residents that are on WIC participants to actually double the value of their funds to ensure that they can participate in the local farmers market. And we definitely utilize and leverage technological resources to help us map out where these resources are for residents who need them. So Durham is doing a lot, and I think that's why it's so special that you all are here today. So again, I bring you greetings on behalf of Durham City and County, and we really hope you have a great time in Durham. Spend money. We love your tax dollars. That's what the mayor is supposed to say. Thank you from the White House to the state all the way down. Thank you, Director Nuremberg, for just making this happen, and your entire team. So grateful to have you all. Enjoy your day.
Huge thanks to Craig. I love Mayor Williams. Thank you so much for being here. Durham is dope. Thank you. I am now excited to sit down with my friend Will McEntee, the Senior Advisor for Public Engagement at the White House, Office of Public Engagement, and Rachel Forensic, the Senior Program Officer for the CDC Foundation, to help us set the stage for today's conversations. While they're joining me on stage, I'm really, really excited to share a video by North Carolina Governor Roy Cooper, who couldn't be with us, but was really excited to contribute this video. Thank you.